When we met up with George Pollock, he was almost ready for the 10,000-kilometer trip to Austria. He's heading there so his adult son Peter can get surgery that could change his life. Pollock and his wife are spending $50,000 to get their son a medical implant that should allow him to hear clearly for the first time. A trip they wouldn't have to take and a cost they wouldn't have to bear if their son lived in another province.
If something is possible to do, we have to do it.
Peter Pollock has bilateral artesia and microtia, where people are born without ear canals and underdeveloped outer ears. He has several mental health issues a psychiatrist has linked to his inability to hear clearly. He can't work, he shies away from social contact, and he didn't want to be interviewed.
I'm old and I don't know how long I'm going to live, that I will leave him knowing that there is something somewhere which can help him.
The Pollock family tried for years to get Peter a Health Canada-approved bone conduction implant doctors say could make his hearing almost normal. But Alberta, where Peter lives, won't cover it, even though half of the other provinces do.
So it just slides right into the magnet, just like that.
Just a province away in Saskatchewan, Ross Weiss has the same condition and had the same surgery, paid for by the system.
It's not fair, and everybody should have access to something of this nature because it is a life changer.
This doctor has done more than 80 of the surgeries, all covered by the Ontario government. He says some patients who need expensive medical care can't get it based on where they live.
It is a kind of a source of ongoing frustration with physicians in many fields as well.
Health Canada approves medical devices, but the provinces decide if they'll cover them.
You know what really strikes me about this, though, is how complicated the system is. I mean, how do people possibly navigate it?
With a great deal of difficulty, I think. There is not one single system nationally, nor is there one single system within the provinces.
And it's not just hearing devices.
It's for pharmaceuticals and dental care and vision, all of these pieces of our body that we left out of the Canada Health Act.
Peter Pollock's surgery is scheduled for January 8th in Austria.
This is the first time in his life that he really got some sparks in his eyes.
Rosa Marcatelli, CBC News, Calgary.